Every time you climb a stair, your knee handles roughly 3 times your body weight in force. That means if you weigh 160 pounds, you're putting almost 500 pounds of load on your knees and other joints, which is why climbing stairs can be more painful than just normal walking. If you have osteoarthritis, you might be dreading climbing stairs up or down. The good news is you can tackle this problem from two angles. One angle is supporting the joints, the other angle is supporting the muscles that stabilize these joints. The joint side focuses on reducing inflammation and the signals in your joints that trigger pain, while also supporting cartilage strength. And the muscle side focuses on supporting and strengthening your muscles that stabilize your joints and take some load off of them. Pay attention as I explain what you need to do if you have knee pain from climbing stairs. By the end of this video, you will learn 4 important things. Number 1, why your knees hurt from climbing stairs in the first place. Number 2, how to support your joints with omega-3s for inflammation and vitamin C plus collagen for cartilage support. Number 3, the muscle side, how to increase quadriceps efficiency and mass with specific nutrients from food you can eat every day. And number 4, one simple meal that covers this week. So let's start with the point number 1, knee inflammation. When a chronically inflamed knee gets hit with a 3 times its body weight force, its alarm bells start to ring, so to speak. What should be a normal pressure on your knee feels like pain and discomfort and stiffness. Not because the pressure itself is the problem, but because the joint lining and other components of your joints are hypersensitive to the movement of climbing stairs up or down. Omega-3 fatty acids, specifically the EPA and DHA, turn down this pro-inflammatory response by directly competing with molecules that promote inflammation. This is different from just blocking pain and inflammatory signals like non-steroidal anti-inflammatory drugs do, like ibuprofen. Omega-3s help to lower and ease inflammation over time, obviously not to the same extent as ibuprofen does. A 2023 meta-analysis of 9 studies featuring over 2,000 osteoarthritis patients found that omega-3s significantly reduce arthritis-related pain and improve joint function compared to a placebo. But not any omega-3s will do. There are specific types of omega-3s and dosages that you need to consume regularly to maximize the potential benefits for your joints. Second point beyond joint inflammation is also cartilage. In osteoarthritis, a person's cartilage is often worn down, which causes increased friction, pain, and other joint problems. While severe cartilage wear might not be fully reversible, your joints maintain a continual repair process 24/7, which means that what you consume can either support your cartilage maintenance or it can even further increase the degradation of the joint tissues. Vitamin C is crucial for joints to produce collagen. And collagen, specifically hydrolyzed collagen that you can find in supplements, contains these small peptide fragments that reach your joint tissue and signal to your chondrocytes, which are joint cells, to produce new collagen. A recent randomized controlled trial involving 2nd to 3rd grade osteoarthritis patients who were taking collagen found that their quality of life and joint health parameters improved, including the WOMAC physical functioning score, which reflects daily activities like stair climbing. Everything we've talked about so far is focused on the joint, what is happening inside of it. But there's another side of the equation, the muscles that are around your joints, that also needs to be addressed. Your quadriceps is the main muscle that activates when you're doing stairs. And when a person's quad muscle is weak or inefficient, most of the load is then transferred onto the joint directly, which means your joint is handling more load than it should. To counter this, we need to target 2 things. Quadriceps efficiency, which means how much energy it uses to perform a function. And also we want to increase the strength and size of the quadriceps, which again takes the load off of the joint. Beyond physical exercises, which you need to do according to your abilities, 2 muscle supporting nutrients that also indirectly support your joints are number 1, nitrates, and number 2, leucine. a specific amino acid found in protein-rich foods. Studies show that when you consume nitrates, your muscles become more efficient at doing their job. Here's how it works. Your body has a smart process of converting dietary nitrates into nitric oxide, a compound that widens your blood vessels and improves blood flow and oxygen delivery to working muscles. As a result, your quads have better blood flow and they are becoming more efficient when you're climbing stairs, which indirectly supports the joints that these muscles protect. Second nutrient that feeds your joint supporting muscles is leucine, an amino acid. After a certain age, your body becomes more resistant to the anabolic effects of protein you eat. This is also partially why some of the muscle mass can reduce as you age. This is called anabolic resistance, and it's well documented. Leucine is a specific amino acid that might be able to counter this anabolic resistance. It directly activates mTOR pathway. Think of mTOR as an intracellular switch that triggers muscle protein synthesis. Without sufficient leucine in your diet, the muscle protein synthesis signal doesn't fire as efficiently. A 2021 study from the University of Sao Paulo in Brazil found a link between increased leucine consumption and stronger quads in older adults. So let's put all of this together into practice. Number one, you need about 1 gram to 1.5 grams of omega-3 fatty acids, specifically the EPA plus DHA. You can get this in one serving of salmon or can of sardines. It's pretty cheap, easy to get 2 to 3 times per week at least. If you want, you can also take an omega-3 supplement. Just make sure it's in the triglyceride form and not the ethyl ester form. If you don't consume fish, you can also take an algae-based omega-3 supplement. But walnuts, flax seeds, chia seeds, or other plant-based omega-3 sources may not be enough. These plant-based sources contain a different type of omega-3, which is ALA. Your body needs to convert this ALA into the active EPA and DHA. The thing is, this conversion rate is very low, so very little of what you consume gets converted to the active thing that your body can use. And if you have any kind of health condition or if you're taking blood thinning medications, talk to your doctor before taking high-dose omega-3 supplements, because they have mild blood thinning properties. Second part of supporting your joints is vitamin C plus collagen. You can get both in foods. Kiwis, lemons, mandarins all contain vitamin C. As for collagen, you can take it through bone broth. If you want, you can also take supplements. That's the quickest route. Some research shows that taking collagen and vitamin C 30 minutes before exercise can significantly increase collagen production in the body. So for example, eat bone broth with a squeeze of lemon and then go for a walk 30 minutes later. Now, the second way we mentioned how you can improve joint strength and function when walking down and up the stairs is by strengthening the muscle. And to this end, we want to consume 2 specific nutrients. Number 1, nitrates. Arugula has the most nitrates of almost any food. Consider eating 2 cups of arugula multiple times per week. Spinach, cooked beets, and beet greens are also high in nitrates, but they're also high in oxalates, which can be a problem for people with kidney stones or kidney health issues. And the second part of feeding your joint supporting muscles is leucine. This amino acid can be found in chicken, eggs, Greek yogurt, and similar protein-rich foods. For example, you can have 2 large boiled eggs with a cup of Greek yogurt for breakfast, and that gives you a big dose of leucine. A 200-gram serving of chicken breast is also excellent. If you're not eating a lot of protein in general, this is arguably the single most impactful thing you can do, because you're directly feeding the muscles that support your knee joints and take the load off of them. Now, having said all of this, it's important to be realistic. If you have mild to moderate osteoarthritis or just some minor joint problems, you might be the best candidate for these dietary interventions. But if you have severe cartilage wear or severe rheumatoid arthritis, you might not experience the same degree of benefit, and you may need more aggressive treatments. To recap, these are the 4 things you need to do. Number 1, consume more omega-3s through 3 to 4 servings of fatty fish per week or an omega-3 supplement to reduce joint inflammation. Number 2, consuming more vitamin C and collagen, for example, bone broth with a squeeze of lemon to support your cartilage strength and maintenance. Number 3, consuming more dietary nitrates which support muscle blood flow. And number 4, consuming more leucine-rich foods These are chicken breast, eggs, Greek yogurt. This increased protein intake will stimulate your muscles to stay strong and efficient in supporting your joints. Of course, none of this will work as well as it should if you're not staying active. So adapt exercises to your situation and abilities. One doorstep action you can start tomorrow. Eat a serving of sardines with a side of arugula salad with a squeeze of lemon juice. This gives you the vitamin C, the nitrates, the omega-3s, and the leucine protein amino acid. Then later, in addition, if you want, you can take a collagen supplement. If you need additional joint support, I have a 40-day arthritis relief joint drink recipe that you can download for free. The link is in the description.